Hello and welcome to Module 1 of the MBL Academy series. What are metallo-beta-lactamases? Throughout history, humanity has faced countless challenges that have tested our ingenuity and understanding of the world. One of the most persistent challenges comes from the microscopic world of bacteria. In this module, we'll explore gram-negative bacteria, their unique characteristics and how metallo-beta-lactamases, or MBLs, can contribute to antibiotic resistance. To start, let's get to know about the bacteria we're talking about. Bacteria are single-celled microorganisms that thrive almost everywhere, from soil and water to the human body. While some bacteria are harmless or even beneficial, others can cause disease. Let's meet Norman the bacterium. Norman is a gram-negative bacterium and his cell wall has evolved specific features that help him survive and thrive. His thin peptidoglycan layer keeps him flexible. His outer lipopolysaccharide membrane serves as a protective barrier, producing endotoxins that help shield him from threats such as antibiotics. Next up, meet positive Polly. We can see that Polly has a much thicker peptidoglycan cell wall that gives her strength, but she lacks Norman's outer lipopolysaccharide membrane. Our focus in this module will be on Norman and his gram-negative allies, who have developed particularly clever strategies to survive in challenging environments. So, how do bacteria cause infection? Imagine you are walking in the park, but you trip and cut your knee. Bacteria can enter the wound through your damaged skin and begin to multiply. This causes a bacterial infection. Antibiotics have revolutionised medicine by giving us the ability to treat bacterial infections effectively. But like all living organisms, bacteria adapt to survive and over time have developed ways to resist antibiotics. There are many mechanisms of antibiotic resistance. One of the most significant involves beta-lactamase enzymes. Beta-lactamase enzymes are produced by gram-negative bacteria and work in a similar way to Pac-Man to target beta-lactam antibiotics, a vital class of antibiotics that include penicillins, cephalosporins and carbapenems. Metallo-beta-lactamases, also known as MBLs, are a type of beta-lactamase. MBL-producing bacteria are present and increasing worldwide, and it's becoming the most prevalent and clinically significant determinant of carbapenem resistance. MBL resistance has been found in Pseudomonas aeruginosa, Acinetobacter baumannii, Klebsiella pneumoniae, and other Enterobacteriaceae. Next, we are going to dive a little deeper into how MBLs target antibiotics. To fight back against beta-lactam antibiotics, MBLs need help from two zinc particles and a water molecule. The two zinc particles bind to the active site of the MBL, which is similar to a mouth, and a water molecule can bind to the zinc particles, and the ultimate weapon is then created. When the MBL enzyme latches onto the antibiotic using its active site, the water molecule is released, which attacks the structure of the antibiotic and specifically the beta-lactam ring. Then, poof, the antibiotic is now useless. There are many different types of MBL. Some are species-specific and some are acquired. Species-specific MBLs can be found in types of bacteria like Aeromonas species, Bacteroides fragilis, Bacillus species, Elizabeth kingia species, and Stenotrophomonas multifila species. And some examples of acquired MBLs are also known as B1 MBLs, which include VIM, NDM, GIM, and IMP1. You may now find yourself thinking, how do MBL-producing bacteria spread? Well, let me show you. When we take beta-lactam antibiotics, the normal bacteria that live inside of us is disrupted. This can result in the development of MBL-producing bacteria in a person's normal bacteria, as well as the infection-causing bacteria. This resistance can then spread to people surrounding the patient, like healthcare workers and family members. When those affected leave the hospital, they can spread MBL resistance to their communities. This allows movement of MBL resistance between the hospital and the community. The ability of MBL resistance to spread from the hospital to the community means that we need to remain vigilant and ask ourselves, Could this bacterial species or infection be MBL producing? And there you have it, the first module is complete. Be sure to join me in the next module to learn about the risk factors of developing an MBL producing infection.